Hello, and welcome to this informational presentation about the NYU Langone Dental Medicine Postdoctoral Residency Program in Pediatric Dentistry located in Tucson, Arizona. Here in Tucson, we are part of the greater NYU Langone Dental Medicine Program, where Dr. Daniel Kane serves as the program director overseeing all of the NYU Pediatric program sites. Our senior associate director is Dr. Akalesh, who is based out of Phoenix. Dr. Amanda Pinder is our Associate Director here in Tucson. She runs everything with the day-to-day of our program and ensures the residency runs smoothly. She's extremely knowledgeable and organized. We have 4 part-time faculty members that we work with regularly that you see listed here. Dr. Andrew Zale, Dr. Lauren Hobage, Dr. Charles Davis, and Dr. Nikki Dejbad. They are all board-certified pediatric dentists. We also have 2 other pediatric dentists that fill in from time to time. So all in all, we have about 7 pediatric dentists that serve as attendings at our site. We also have an orthodontist, Dr. Day, who we work with on interceptive orthodontic cases. He comes in 1 day per month and lectures to us, and we exclusively work on orthodontic cases on those days. We also complete interceptive orthodontics with some of the pediatric attending dentists as well. We have 2 dental anesthesiologists that we work with doing primarily in-office IVGA, Dr. Caputo and Dr. Bonander. I'll touch more on that later in the presentation. Overall, our faculty members here are a huge strength to our program in Tucson. They are extremely dedicated and work to provide a supportive learning environment for us as residents. Let's talk a little bit about the program overall. It's a 24-month program. We start each year on July 1st and finish 2 years later on June 30th. Here in Tucson, we have 6 residents per class for a total of 12 residents. At the end of the program, you'll receive a certificate in pediatric dentistry. As part of the program, you are required to take the QE exam at the end of your 2nd year. This is the first step in the process of becoming a board-certified pediatric dentist. By passing the QE, you're eligible to sit for the oral board certification exam the following fall. Let's get the important stuff out of the way. There is no tuition charged to residents, and you do get paid. You can see the current stipends for this year listed at $50,000 and $53,000 respectively for the 1st and 2nd years of residency. As an NYU resident, you receive 8 holidays, 25 vacation days, and 4 CE days. You are required in your 2nd year to attend the AAPD conference to present your research, and the CE days are used for that, at least in part during your 2nd year. I know that I mentioned this earlier about our faculty members here in Tucson, but I again just want to reiterate that they are very dedicated faculty, and they have all been involved with our program for several years and are very invested in us as residents. We have a great auxiliary staff here in Tucson as well. You will always have a well-trained dental assistant working with you. The vast majority of them are bilingual and speak Spanish, which is a huge asset here in Tucson, as we have a lot of patients for whom Spanish is their first language. We also have hygienists that we work with and a great front desk staff at all of our clinics. Here in Tucson, we work at the El Rio Community Health Center. El Rio is a large FQHC, or Federally Qualified Health Center. It is quite a big system here in Tucson with 12 different locations. El Rio is very involved in the community and well respected throughout Tucson. They provide medical care, specialized care, pharmacy, and lab services in addition to dental services throughout their locations. There is dental at quite a few locations, and then we obviously have pediatric dental residents as well as AEGD residents at El Rio. As pediatric residents, we work at 2 of the El Rio clinics that you see pictured here, Downtown Congress and Southwest Tucson locations. Just to give you some context, these clinics are actually fairly close together and only about a 10-minute drive from one to the other. I'll go into more detail about the clinics over the next few slides. Our Southwest clinic is the larger of the 2 clinics we work out of. Each room at this location is a private individual quiet room with a door. Each room has nitrous plumbed directly in. And this is the location that we use for all of our oral conscious sedation as well as IV general anesthesia cases. There is also a large resident room here and a meeting room that we use for our teleconferencing and didactic lectures. Our Congress clinic is the smaller of the 2 clinics. As you can see from the photos, this is an open bay style setup. We have portable nitrous here. There are other quiet other quiet rooms with closed doors at this clinic that's used by general dentistry, and we can pull into those rooms if we need to. I wanted to dive a little more into what you can expect for sedation experiences here in Tucson. We do oral conscious sedation 2 days a week. During those visits, one resident serves as the operator and one as the monitor. We don't do an overabundance of these cases, but you won't have any issues meeting your requirements. I would say on average, you can expect 25 to 30 cases as a resident. We also provide in-office GA with a dental anesthesiologist 2 days a week. For in-office GA, we are generally reserving that for our overall healthy ASA 1 and 2 patients. We usually do between 3 to 4 cases per day, and you will have all your requirements done by the end of your first year. You will definitely get a lot of GA experience throughout your time here in Tucson. During your second year, you will also get experience of seeing patients in a hospital setting for GA at Tucson Medical Center. This is where we take patients that are not candidates for in-office sedation, more medically compromised patients, or patients that require additional monitoring for whatever reason. As part of the program, you will partake in many different rotations. You can see some of them listed here. We already talked about orthodontics. One of our main rotations that you will participate a lot in is Children's Clinic at Tucson Medical Center. This is a specialized clinic here in Tucson that serves to provide both medical and dental care to special needs and medically compromised patients under one roof. We provide dental care at this site for these patients several days a month and take turns rotating through as residents. There is a dedicated dental room here that we use. This is also the site of our cleft clinic, where you will rotate through with local oral surgeons and orthodontists to manage cleft lip and palate cases. During your first year of the program, you will rotate through pediatric medicine, emergency medicine, and anesthesiology. These are all done at different sites throughout Tucson. Our pediatric medicine outpatient clinic rotation is with the pediatricians at El Rio. The anesthesiology rotation is a month long, and that is completed with anesthesiologists at Tucson Medical Center and is absolutely fantastic. The anesthesiologists you will work with are part of an anesthesiology group, and they have all signed up for and agreed to be mentors and faculty members, so they are really eager to teach you, and you will learn so much during that rotation. We do our emergency med rotation at a different hospital, Banner Medical Center, which has a pediatric specific ED. This is also where we take our call, which I will touch on later. During your second year, we have specialty rotations that we also complete at TMC, and we rotate through a community health rotation at Indian Health Services in Sells, Arizona. In addition to our strong clinical curriculum, there is also a didactic curriculum. Locally, we do literature reviews 1 day a week. We go through the core curriculum from the AAPD, current literature, case studies, and several different textbooks with our local faculty. We also have a local pediatric dentist that volunteers with us every other week to meet and go through more classic literature, AAPD policies and guidelines, and board preparation. He's also very eager to provide any knowledge he can about life after residency. He can discuss contracts, interviews, and anything along those lines. In addition to that, NYU provides a strong didactic curriculum for all their residents across the country. We meet once per week as first-year residents for teleconferencing sessions with all of the other pediatric residencies. These days usually involve lectures on different topics within pediatric dentistry, and through the teleconferencing system, all sites can interact together. You will also have an online curriculum that is comprised of self-study modules that you complete during your first year. These cover a variety of topics and are done during your own time outside of clinic. On top of that, we do have some guests that come in and lecture to us. There are some other requirements such as case presentations on top of that. Outside of the clinic, we take call for the Children's ED at Banner Medical Center. The first year residents rotate call, and the second year serve as backup to go in with them as needed. So with 6 residents in each class, you are on call about every 6 weeks. Overall, I would say that our call schedule is not too heavy. Most calls are in the evenings or weekends. It's extremely rare to be called in during the middle of the night. The vast majority of the call is trauma related. You're definitely not getting called in for each and every toothache that comes in. The physicians in the ED are really great about properly utilizing us as residents. I obviously wanted to add some stuff about Tucson and where you'll be living. I would classify Tucson as a large college city. There are over 500,000 residents in the greater Tucson area. It is home to the University of Arizona. Go Wildcats! Although we are in the Sonoran Desert, we are surrounded by mountain ranges on all sides. It is almost always sunny out. It gets very hot during the summer months, followed by the monsoon season, which brings beautiful summer rains, and a mild fall, winter, and spring climate. Although Arizona is known for its bigger national park, the Grand Canyon, here in Tucson we are home to the Saguaro National Park, which is named after the iconic desert cactus you see in the photo. It's an absolutely beautiful area of the country, and Arizona has some of the best sunsets you can ever see. The mountains of Tucson provide hundreds and hundreds of miles of hiking trails, so if you like to be outdoors, you will never get bored. Mountain biking is also a huge pastime in Tucson, and there is a large community of mountain bikers here. It is also a foodie town. There are so many restaurants and lots of delicious Mexican food to devour. In 2016, Tucson was designated as a city of gastronomy by the United Nations Educational, Scientific, and Cultural Organization, which is a designation that only 36 cities in the world have. If you like to eat, Tucson is the place for you. Each year, Tucson also hosts the country's largest gem show. Tens of thousands of people descend on Tucson to come and buy, sell, trade gemstones and precious metals. As I mentioned before, we're also home to the U of A, so there's a large student population as well. If you want to get out and explore as a resident and use up those 25 vacation days, there's plenty to do within just a few hours' drive. Mount Lemmon is just outside of Tucson and has the most southern ski slope in the country. It's pictured here in the fall, but in the winter, the north side of the mountain receives enough snow to go skiing. During the summer months, it's a great escape from the heat of the desert and is 30 degrees cooler at the top than it is here in Tucson. The Grand Canyon needs no explanation and is about 5 hours away, and Sedona is 3 hours away and known for its gorgeous red rocks. We're also only 3 hours from the ocean here in Tucson. Rocky Point, Mexico is a really popular destination and considered Arizona's beachfront. If big cities are your thing, we're only 90 minutes south of Phoenix. Overall, living in Tucson has been a really great experience, and there's no shortage of adventure to be had. So thank you for your attention and interest in our NYU Langone site here in Tucson, Arizona.